Good evening. Welcome. My name is Sydney Stowe. I'm the director of film at Dartmouth College and Hopkins Center. Thank you. Just want to say, we saw this film at the Telluride Film Festival last September, and it was a premiere screening, and my colleague Johanna Evans and I sat there with a 22-year-old girl, and I don't know who cried more between the three of us. And we were so excited to see Ricki and Annie's work. They are our favorite filmmakers, that it was all we could do not to bring it to you all last fall. But it took a lot more work, and I would like to thank the Rockefeller Center and the Women's Center, the Center for Women's Studies, Gender and Sexuality Studies, because those two partners came with us and made this weekend and this visit possible. And I think that as long as I've worked here, we show a lot of people's work, and we show alumni work, and Ricki Stern and Annie Sundberg are our favorite directors. Between them, they have 10 films, so if you feel like you've done nothing with your life, you can look at how young they are and think they've made one pretty much every 6 months. And this film is personal for me, but also it's something that they say it's essential viewing, and I kind of agree. I think that I'm so grateful that you're all here tonight, and after the screening, when we saw this in Telluride, we were so thrilled that we wanted to bring everyone in the movie and everyone affiliated with the movie here. So you probably know this, but in addition to Ricki and Annie, we will have Texas Senator Wendy Davis, and I know, and the incredible other hero of this film, Dr. Colleen McNicholas. So they will both be here with Ricki and Annie for a conversation after the screening. So I'd like to actually turn this over to the directors who are gonna say a brief hi, but I just want to thank all of you for coming tonight, and I want to thank Dartmouth and the Hopkins Center, because this is probably the most exciting and most important screening we will do in maybe in the year. And so I'm grateful for the privilege to be able to show it. Thank you.
That was a very nice introduction. Thank you. And we're just really thankful that you guys all came out. This is a film that is on Netflix right now. So you're here. That really means a lot to us. And so if you like it, you can tell your friends it's on Netflix. We're always happy to come back to Dartmouth. It's really a treat for us. And to have Sydney and the Hop and the Dartmouth Film Studies and everyone support us and bring us back is really, we're very happy. And I guess you can say about Wendy and
Yeah,
Colleen.
I was just going to say, because you're not seeing it on Netflix, you get the added treat, as Sydney mentioned, of having conversation with Wendy and Colleen afterwards, and they are awesome. So thank you.
Thanks.
Yes, thanks.
Thank you.
Thank you. Thank you so much, ladies. I don't even know what to say. All right, someone say something. Okay, well, I'll start. When we were thinking about questions for tonight, one of the things that I keep remembering when they show all these women's marches and all of these rallies, there's this poster that says, "Why are we still talking about this?" And I'd like to throw it out to all of you, because there are people in my generation that are like, but isn't this a right, a law, a Supreme Court decision? Like, why are we still talking about this? And this film makes it so real that we have to keep talking about this. And I'm sort of curious what your takes are on that question.
Well, I think the film did a really good job of explaining why we're still talking about it. We're still talking about it because there are politically expedient reasons to continue to put this on the table and to do it for purposes of personal political gain. It should have been a right decided long ago. It should, in the mainstream of America today, be something that's settled. And interestingly, some of the most ardent political voices on this particular issue are those who actually don't really care much about it at all. Those who, in many instances, may have actually paid for or been partnered with someone who's had an abortion themselves. Those who have no personal moral compass that says this is wrong, but for whom they understand it's been a very powerful political cudgel to use for purposes of their own personal gain. And so long as they continue to be rewarded by that in the political spectrum, we are going to continue to have this conversation.
I'm not sure that there could be any better answer than that.
And the only thing I would add to that is it's something that we've often talked about, and there's a book that was out this past fall called Sex and the Constitution, that abortion has existed since antiquity. It has existed throughout cultures, across cultures, when it's been forbidden, when it's been prohibited, it's never been, no one here I think is pro-abortion. It's pro-legal, safe abortion. And I think, at least I'm speaking for myself here, but the thing that I think is interesting about why it continues to be part of the conversation is that it seems that there's an inability to face the reality that we live with abortion.
So I'll just make one caveat to that, which is that I am actually pro-abortion because there are people who currently need abortions. And so long as there are people who need abortions, for whatever reason that is, I feel like I can morally support that.
Well, and I think what's interesting, in my lifetime, even the word feels more charged now. Even in class today, one of the professors was starting to say, and I could hear her almost pause, like, well, it's about abortion. And I wonder if now that word has just changed to mean something different for most of us, when it is, in your words, a medical procedure that in some cases takes 3 minutes, which I thought was absolutely fascinating. And because I think you see the pictures and the posters, and it's hard to separate that from the actual clinical experience that is legal and safe and necessary for so many people, because that word just seems different now than it did before. And I also took away from the film that pro-choice, pro-life, like the labels that people use in this argument has also changed. Is that my impression, or does that feel like that's actually true?
I do think that one of the successful strategies of the anti-choice movement has been to really co-opt language and to use language that feels good, right? But it's also one of my favorite things to try and take that language back, right? To say, when I'm confronted by somebody who says, well, I'm pro-life, I say, that's great, so am I. Can I tell you what that means to me, right? And so I think we have a responsibility in the movement to think about very intentionally the language we use and to explain why, in fact, we believe what we believe. It is also true that women who are, or previously had self-identified as pro-life, have abortions, right? That happens almost weekly, I will say.
You have to tell that story.
It is so more than once in my life, I have had the privilege to take care of a patient seeking an abortion who was, prior to her abortion, a abortion clinic picketer, and returned to that picket line after she had herself was able to secure her abortion. Because, and I think that's a reflection of sort of what Wendy was saying, which is that, and I say this almost a little bit flippantly, but, when you sort of talk about abortion in the political lens, the exceptions are rape, incest, and my own. But the truth is, in my office, people don't care what politicians think, right? They don't care what their elected official thinks. And the truth is, as Wendy said, most of those elected officials also don't care, right? And so I guess for me as a physician, that is probably one of the most frustrating parts of being part of this movement, is that I know that there are, that the sort of advancement of all of this legislation is not rooted in public health, right? It's not rooted in what's best for women. It's not sort of an attempt to make healthcare for women safer. It is really just, it sits in this place of advancing political, goals.
And I think the film did a really good job of showing how this issue moved from something personal between you and your doctor or you and your partner and political. And I was curious, one of the things we were wondering is, having not seen Operation Rescue or the National Right to Life Foundation on television or get as much airtime in the past, what was that like? Because I know you were trying to present a balanced perspective on the discussion. What was that like interviewing those groups? Did you feel like you had access? Did you have their trust? And how have you heard any feedback on how they feel the film, having seen the film now on Netflix? What the response has there been a response from that demographic?
Well, I will start and say that I think, we as filmmakers came to this topic with our own bias, as we all do when we approach things. And so we did want to ask the questions to the pro-life, the anti-choice community, and we respected the language that their language is, they're pro-life, they don't call themselves anti-choice. People have said, and I think it's true, that the heart of the film really is in the pro-choice stories that we tell. We don't tell the pro-life stories in as much of an with as much emotional context. And there were some people that we met that certainly have and are very driven and focused and have their own personal reasons why they are anti-choice, pro-life. It was just that is the perspective we brought to it. So that's sort of how we look at it. So while it's, I don't know if it's balanced. I don't really know, but I think we attempted to hear many sides of this issue, which is a complicated thing, unfortunately. And I'll let you answer the second part of it. But and so the trust of it is that the way we make films is really just to ask these open questions and to say we want to be respectful of various opinions in life. And early on, we met with the people who planned the March for Life. And that really helped sort of begin to open doors.
And I'll just speak to in particular, working with Texas Right to Life and John Seago. We also worked with another Texas lobbyist group, which was, we ended up not including in the film. But what I found interesting is that Texas Right to Life, the gentleman, John Seago, who's in the film, he was just very open. He was very helpful. During the course of filming, he let us know how his lobbyist work was advancing certain bills through the legislature. He let us know what the status was, what the potential court dates were, because there were challenges both at the state and then later at the district level. And I will say there was a certain amount of trust. I mean, I think that he was basically saying, I'm going to give you my story, and I'm going to trust you to portray that in its accuracy. I think that it's interesting with someone like Troy Newman, who's a little bit more seasoned, I think, with media. There's a great film called Armor of Light, where you look at the evangelical and the gun conversation. And I think that he feels very sure of himself as well. And I think that he felt very confident in sort of presenting who he was. Tony Perkins was trickier in that the Family Research Council, it's in this huge edifice of a building that was financed by the DeVos family. And it's basically, it's monolithic and it's very big, and they have a lot of far-reaching agendas, not, abortion rights is just one of them. And I think that he was the one who, he was probably the most savvy about how he was the most considered, I think, in how he responded in his interview.
One of the pieces when I saw the film at Telluride was the whole piece about the priest and the clergy and their relationship with college students. Mm-hmm. And I wondered, were there other voices that you had to cut just out of time or continuity that we wouldn't expect? Because that one was totally surprising to me when he talked about that, and I could imagine my mom when she was in college, it was all girls. It was interesting that those were their allies, and I don't think I would have ever considered that perspective. I'm wondering if you found other places that were surprising, or other gray places, like you were saying, the protester who protested, had the procedure, and then got back on the front lines.
Yeah, I mean, I think we shot 60-plus interviews, and we, partly as we were researching as we were filming, because we got this commissioned right after the election, and so we started filming in 2017, not really knowing what the story was going to be, and so we were figuring it out as we were going. So we interviewed many, many people. I think some of it is, and we talked about this today, it's the head of NARAL Pro-Choice America spoke in an interview that ultimately didn't make it in the film about her own abortion and how she felt let down by the pro-choice community because she felt that it was made to seem as if it was an easy choice and that there wouldn't be conflict, or that she wouldn't be considerate, she wouldn't have to consider it. And she did, and it was a difficult decision for her, and she ultimately made that decision to have an abortion, and she says, I'm grateful for having that choice, and ultimately goes on to say, these are tough decisions for some that's not, but ultimately people are going to have abortions. So let's make abortion safe and supportive, and not something that is going to harm, a person in that procedure. So it was a more nuanced sort of conversation to have with someone who is running one of the organizations that leads in the pro-choice movement.
The only other thing I would add, that I think as we were researching this, and Colleen, you know this intimately as a provider, but there was that early on debate within Planned Parenthood about, do all Planned Parenthood, will they all now provide abortions? And it was really under Faye's leadership that basically Planned Parenthood became committed to providing full women's health care, including abortion services. But that was an interesting time for a lot of people, and I feel like what we were hoping to do with the film is this idea that you come to it with an assumption that religious groups are they're aligned against access to abortion care. And in fact, it was an interesting web interrelated of Protestant ministers and rabbis who were very helpful in the early days of abortion reform laws in the US. So it's like, we were hoping that some of that stuff came out.
So, anybody have any questions? I have a couple, but we thought there were maybe a few of you might have questions for our guests. You? The question is, can you not get an abortion in a hospital? Why is all the focus in films and protests on clinics? And secondly, if you were interested in supporting abortion rights, how could you get... What's the most effective way to be supportive? Thanks.
So in most places, no, you cannot get an abortion in a hospital. And there's a whole complexity of reasons why that's true. So in most of the places that I work, so in Oklahoma and Kansas, there is not one single hospital that will provide an abortion, regardless of the indication. In Missouri, at the university that I work at, which is a private university, Washington University, we do provide abortion services, but the cost of any care in the hospital is exponentially more expensive than the cost of care in a clinic. And not only are there few hospitals that will provide the procedure, when you layer on insurance bans, both public insurance and private insurance, for example, in Missouri, is by law prevented from covering abortion as part of your insurance. It means you're paying out of pocket for that service. So as you learned, the vast majority of abortions happen less than 10 weeks of pregnancy. If you have that abortion at a clinic, and the truth is actually most abortions in this country happen in independent clinics, not in Planned Parenthoods. But if you have that abortion in a clinic, it will cost you probably somewhere between $300 and $500. If you have that 9-week abortion in a hospital, it will cost you somewhere between $8,000 and $12,000. And in a 9-week procedure takes me somewhere between 3 and 5 minutes to perform. So that's just economically not possible for most people. And if you think also about sort of many hospitals, particularly academic hospitals, being tied to state universities. There's another layer of potential sort of access restriction, which is, the University of Missouri, our state institution, which has an OBGYN residency training program and provides all of the other services that are should be available for OBGYN patients, basically was threatened by the legislator. They said, if you do this, we will take away all your funding. And so that's an impossible decision for a hospital, right? So that's the answer to your first question. Everybody probably has an answer to your second question, and I'll keep it brief. I would say it depends on sort of where to put your dollars sort of depends on what your interest and where you want to move the needle. The sort of issue of abortion access spans a whole host of things, right? There's people doing great policy work, there's people doing great legislative work, there's people doing great grassroots work. I tend to the organizations that I like to lift up are the ones that are helping people pay for their abortions. And so those are your local abortion funds. The National Network of Abortion Funds, NNAF.org, has a sort of map where you can click your state, and it will sort of link you to the places that are helping women pay for their abortions.
I completely agree with that. And I do think that there are varying levels in which you can demonstrate effective support for the right to access safe and legal abortion. One place to begin thinking about that is where the law, of course, still preserves the right, but the access has been shredded. States like mine, states that Colleen works in, represent and reflect that shredding. And in those states, those abortion funds that pay not only for the procedure, but they recognize that in states like Texas, one of the things that keeps women from being able to access abortion are the costs of travel, the overnight stay they have to have, because we do have a waiting period between when you first see the doctor and when you're allowed to actually have the procedure. That is an effective way to support access. If you're thinking about it from the grander 30,000-foot level, you're thinking about policy. And if you're thinking about policy, you're thinking about policy makers. Who's making this decision? And what experiences and values do they bring with them? It's very interesting that on the anti-abortion side of the ledger, a great deal of energy, money, and voting activity is driven by that particular issue. On the other side, until the last few years, we've had the benefit of sort of taking for granted that we have that right, and it hasn't motivated people in the same way. Many Republican voters believe in the right to abortion. They believe that Roe versus Wade should be upheld, but they're not deciding to reject a politician based on a position that is otherwise. The more that those voters begin to say, I'm going to make my voting decision in a way that reflects my value that women should continue to have this right, the more we're going to see voters moving from electing those further to the right Republican candidates, even within their own primaries, where this issue has become a flashpoint between them. There, of course, are also ways to support those organizations that are fighting to keep abortion safe and legal. The Center for Reproductive Rights was largely responsible for overturning the case from Texas. Obviously, NARAL, pro-choice, Planned Parenthood, and other clinics that are providing abortion care are other ways to do it. And then if we don't have the ability to provide financial resources to this conversation or to the continued viability of this right, we have ways that we can use our persons, our bodies, for that protection. Working as an escort at a clinic, making sure that you're registering voters to help support candidates who continue to value that choice. No one of those is any more effective than the other, and every single one of them is absolutely necessary to make sure that we maintain the right to safe and legal abortion in America. So right now, there's a rush. The moment that the Supreme Court was seated as it currently is, with Brett Kavanaugh's appointment of late, there was an immediate reaction in state legislatures around the country from politicians who wanted to add this anti-choice bona fide to their resume, filing legislation, many of them hoping to be the one that files a piece of legislation that passes into law, that makes its way to the Supreme Court, and that ultimately delivers the death blow to Roe versus Wade. So there will not be the luxury of waiting. What some courts have done, and in fact what did happen with the Texas case, the reason that we had 19 clinics that stayed open was because only a part of the law was allowed to go into effect while the case wound its way through the court system. If the law in its entirety had gone into effect, we would have gone from 41 clinics to 5 clinics in a state of 27 million people. And it isn't just that you're far away from the clinic that creates the problem. It's that now you've got 5 clinics serving a state of 27 million people, X number of whom are of reproductive bearing age, and the wait list grows. And that happened even with only 19 clinics left. The wait list for receiving abortion went from a few days to over 3 weeks in the Dallas and the Fort Worth areas. And that meant that women were being pushed later into their pregnancies before they could have it. And it almost is a counter reaction to what the anti-choice community purports to be arguing to achieve. There will be cases that go very quickly to the Supreme Court and are going to test how far they're going to push the limit of Roe v. Wade. I personally believe that under Justice Roberts, who I think takes a very personal responsibility to his court as the Chief Justice, to the legacy of his court, but also to the context of the court's presence in the larger political and social conversation, I believe that he will strive to keep Roe v. Wade from being overturned because he understands how tumultuous that is. However, I do think that the court is going to allow the chipping away of that right. If Whole Woman's Health versus Hellerstedt had come before this court, it's likely it would have been upheld. And what that means is that they will avoid the social upheaval that would happen. Imagine if Roe v. Wade were overturned tomorrow. We haven't seen anything. The Women's March that we saw in Washington after the inauguration, we haven't seen anything like what will occur in that instance. And I think that they understand that and that they're going to work to avoid it, but to obliterate that right to the point that they can. And for those of us, I count myself among them, although I no longer have a uterus, but for those of us who have the capacity to seek safe and legal abortion by hopping on a plane and going to another state where it's legal, we'll continue to secure and own that right. And what I hope is, even for those women who do, there will be an understanding that there are swaths of women whose very lives, whose very futures, whose very responsibility to the existing children that they have and are struggling to support, whose very future and future opportunities will be lost, and that we will fight as hard for them as we would have if the right had wholesale been overturned and we ourselves would have lost it too. That our sisters in marginalized communities will matter as much to us as our own ability to access abortion would matter, and that we'll fight for them.
you guys hear that question? Okay. Do you want to repeat it?
First, congratulations and thank you for being involved at 17 and 18, because I can tell you that when I was 18, I was not doing the things that young people are doing now. So I want to sort of lift that up, and for all the young people in the in the audience. The question was, as an 18-year-old high school student who wants to help continue to support the right, what could you be doing? And I guess my first answer is what you're already doing. So being educated about the issue is so vitally important. And talk about it. We sort of have a joke. I talk about abortion all the time. Like you go to the restaurant and you order your food, and the waitress says, "Oh, what do you do for a living?" "I'm an abortion provider." Of course, it's not the only thing I do, but it sort of gives an opportunity to open up a discussion with people. And what I've actually found is even in a community where you sort of are a little bit like, I'm not really sure how this is going to go, the vast majority of people actually support abortion access. And so it gives an opportunity to talk about the nuance of abortion. Why do you support it? Why should we be talking about it? And then the other thing I would say is show up, right? So go to the legislator when they're hearing bills. Tell them what you think about the sexual education program at your high school. Tell them why it's important, right? Legislators talk all the time about their constituents, right? My constituents don't do this. My constituents want that. Every time I'm at the legislature, I say, "So, Senator so-and-so, I took care of 10 patients from your district last week." "No, you didn't." "Yes, actually, I did. Women in your district have abortions." So not all of your constituents believe what you're saying, right? And they listen to that, right? They have to be held accountable to the people that they serve. So show up.
And that day in Texas that became known as the People's Filibuster Day, that was all about showing up. And what was so beautiful about that particular day was that the people who came, they came because they believed and felt strongly about this issue. They never expected, though they wanted to figuratively add their presence and their voice to what was happening there that day, they never expected that it would literally be their voices that would bring that filibuster past the midnight deadline. And it's such a beautiful example of what happens when we decide to show up and to just do what we can do. I think often we feel like our one vote, our one voice, our one committee testimony or card that we sign and send to a legislator, that one thing won't make a difference. When every one of us makes that decision, then we've ceded the conversation to someone else. But when every one of us decides otherwise, that we will just own the personal responsibility that belongs very powerfully to us and recognize the privilege in extending it, one by one by one by one, before long, we become a powerful group of change-making people. And I would just encourage you, when you talk to friends, and I'm sure you have them, who say to you, "I'm not going to vote, my vote won't matter," just to encourage them that it's the most important thing that matters.
And specifically to your question, 3 years ago, Wendy Davis founded an organization called Deeds, Not Words, and it is exactly what you're asking. It is a community that empowers young women to become change makers and teaches you tools and gives you information on how to make a change in your world. And so you can look it up on deedsnotwords.com. And unfortunately, I didn't know we had high school kids here tonight because she actually gave a workshop earlier today on this exact topic. So this is her current passion project, so you can definitely check it out online, and that'll give you some tools and some other people within the community for more information on that.
There's been, much
Yeah, so the question was around the fact that the United States is the only industrialized developed nation who has a rising maternal mortality rate. And I can tell you that the percentage of that is attributable to abortion-related risk is 0. So that's the first thing, right? But this country has a health access problem that spans all of reproductive health. And I say that, obviously, I believe abortion access is a problem, but also maternity care access is a problem. Access to good primary care that keeps people healthy in between their pregnancies is lacking. So I think the rising rate of maternal mortality and morbidity is really related to the fact that we have swaths of the country that have no access to good primary preventative care and sort of general OBGYN care to help people stay safe. It certainly also has some component of not having access to birth control, right? So being able to time and space our pregnancies and to have them at a time when our health is most optimized is our best way of reducing maternity-related morbidity and mortality. And if you don't have access to reliable contraception, which of course is the real consequence of closing clinics, like in Texas, right? That yes, people lose access to abortion, but they also lose access to their birth control. And so, you know, one of our best tools that we have to help people better space their pregnancies and time them when they're healthy and to prevent unintended pregnancy has also been stripped away, again, in this very paradoxical sort of, what is your goal kind of way, right? So we have less healthy people, more unintended pregnancy, and then more abortion or maternity-related morbidity and mortality.
Yeah, if abortions are not being performed at teaching hospitals, where and how are OBGYNs learning how to perform the procedure?
So there is, so the question was about if abortions are not being performed in teaching hospitals, where are people learning how to do it? And so there are teaching hospitals that are doing it. Those generally tend to be either private institutions or the public institutions in places where they are progressive states, right? There is a program in OBGYN residency called the Ryan Residency Training Program, and that was an initiative that was started out of the University of California in San Francisco to sort of fully integrate abortion and contraceptive training into OBGYN programs. And so there are somewhere between 50 and 60 OBGYN residency training programs who have that. But even amongst those, there are large numbers of those programs who do that training in collaboration with a Planned Parenthood or an independent abortion providing clinic. And so the program might be pairing with another clinic who assumes the volume of that service.
And I would just say that Curtis Boyd, who's in it, who's in the film, who's 80, who is teaching with that program. That woman that he's teaching is part of the Ryan Fellowship Program.
Go ahead.
To be really clear, I'm not here as a representative of the McNicholas Center, but I am the residency program director at a teaching hospital nearby. We are a Ryan residency program. Our residents perform upwards of the 95th percentile of abortion procedures at Dr. McNicholas Center, at a Quality Health Center in Concord, and at Planned Parenthood in Manchester. So this is very much alive and well in our training program here, lest anyone think it's not.
Thank you. I didn't want to out you, but I'm glad you did.
Maroon sweater.
Yeah, and also, thank you for mentioning that. There's also states where advanced practice clinicians, so nurse practitioners and midwives, can also provide abortion care. New York, California, there's a whole host of places where other clinicians can also provide great abortion care. Oh, great. I'm learning so much.
I thought the film was amazing. I mean, incredibly devastating for someone my age. But can you use, I'd like to know two things. One, what is the response to the film that you're having? And can it actually in some way be used as a recruiting mechanism either for doctors, which is what I want to sign up, you know, I'll be there, or for other ways, because it's incredibly powerful.
I'm going to just say that Netflix makes it available for you to use as a teaching, if you want to show it in an educational setting, you can just go on their link and it's, use it and there's a way to download it and stream it and they don't charge. So anybody can use it in the high school or any kind of teaching setting that you want. So just know that. What is the response? It's hard because it's Netflix. So, we don't know. We don't really know.
Do you think it was having come out on Netflix, it's in televisions and it's so much more accessible
It's in
than being in a
190
theater.
countries, and we did speak to our Netflix exec, and he said more people have seen it because they're in so many households, so they know the numbers, they won't tell you the numbers, than it would have seen it had it been on a more traditional platform like an HBO or a Showtime.
So people are watching it, so we hear.
I've seen lots of social media tagging of what's wrong with America?
In the second row, go ahead. No, that's a great point. We talked about that last night. What can be done to reduce the shame or the stigma around abortion if it is actually as common and prevalent as the numbers say? And why is the word still like she says to the poor white person, "Oh, I'm an abortion provider," and that's sort of like mic drop. So where do you guys think is the answer? Because I think that's part of it is the shame, and there's nothing to be ashamed of.
First, I want to begin this answer by saying no one should feel that they have to share that story if it is something that they're not comfortable with. And it took me some time to share my own. The day that I stood on the floor of the Texas Senate and read all of those stories, and when I came to the story that made me feel as though I were reading my own out loud, though it was written by another woman who had shared a very similar experience, I came very close that day to sharing my own and made a decision not to because I believed it would make the day more about me, and I wanted the day to be about the people who had been silenced. But I did share it not long after, during my gubernatorial campaign, that I had made a very difficult decision in a very much wanted pregnancy post 20 weeks, which is now illegal in my state, after discovering that the much wanted pregnancy that I was carrying had a very fatal fetal abnormality. And I was confronted with something that I would not wish on any human being. That story, the story the woman told that moved Bill Clinton's thinking on that ban, for example, when we are comfortable sharing them, they are the only things that really will work to remove stigma. And what is very gratifying to me to see after the filibuster in 2013, there was a very immediate reaction of women coming forward who now felt comfortable sharing their stories. And the more that did, the more that did, and the more that did. And I think the more we have that conversation around what it is a healthcare decision. sometimes more difficult than others, but made for very personal reasons. And the more that we can share what those personal reasons look like, and the more that we can create understanding around it, the more it will destigmatize it. And I think we're just going to continue to see that happening. I'm encouraged by the efforts that are underway to give voice to that, to give a platform for it, like Shout Your Abortion, and so many others that have happened by different nonprofit groups around the country to provide space for that. When we humanize issues, no matter what the issue is in political conversation, that's how we change hearts and minds. And you could point at any issue, whether it's marriage equality or gun safety, no matter what it is, when we put a human story behind it, we do change public opinion, and we do ultimately change what happens in political outcomes too.
We have time for one more. She was asking, what do you think are the most common misconceptions about abortion that are out in the public media today, and how can we work to change that?
Well, I want Colleen to answer this too, because I know she, in her experience, has a unique perspective on this. My political perspective, you will notice that the anti-abortion movement tries to keep the conversation on very charged terms. They didn't call it post-20-week abortions. They called it partial birth abortion when they were trying to ban it initially. They show pictures of post-20-week developed fetuses, and they want all of us to believe that that is the space in which most abortions occur. That is absolutely not true. About 1% of abortions occur post-20 weeks, and the vast majority of those occur for reasons like the one that I experienced. Most are occurring very early in pregnancy, and that is by moving the conversation to something that conceptualizes a baby, it changes emotion, and that's very purposeful. That's a misconception. Another misconception is why women have abortion, and I think people would be surprised to know that the majority of women who are having an abortion already have children. It's not that they've flagrantly decided, oh gosh, I want to go out on Friday night and I don't want to be encumbered by having a child, which again is a misconception that is floated, and the hope is that you will believe that. For many, and I say this with all sincerity, many women who choose abortion are making this decision out of love. They're making this decision out of love for children that they already have, that they're already struggling to care for, and who understand that bringing another child into their family not only is a disservice to that potential, but also to the children that they already have. There's so many reasons to have abortions, and the misconception would like us all to believe that they're made flagrantly, that they're made for convenience and out of selfishness, and that's anything but the truth in what I know to be the case. And I'm sure as a doctor, Colleen could tell you as well.
Yeah, and so I totally agree with both of those things. The other thing I would say is safety. So most of these laws are purported to address the sort of safety of abortion and how it's not safe, and women are being hurt during their abortions. And so that's the other one I would say is a really important misconception. Abortion is amongst the safest procedures that we perform in medicine, and in fact, it's much safer than continuing your pregnancy. And so, again, sort of thinking again about sort of reclaiming sort of the words and the language of the movement, I think this is an important one, right? Because when your strategy is to put something to the public that on the surface seems reasonable, pro-choice people think it's reasonable that abortion should be safe. But if you don't spend every day in the trenches of abortion care, you have no idea what they're talking about and if this is really a problem that has to be addressed, right? So that's, again, a very purposeful tactic, right, to make it seem like it's an unsafe procedure when the reality is it already is.
I think I'd like to end with a question now that, given all of your work in this film and all of your work in real life, we were sort of talking about what we wanted to know if we could ask you anything, and the question was, what are things that concern you looking ahead, and what are the things that give you hope about this issue? And maybe start with you girls who made this beautiful film.
I grew up always knowing that I had access. It was my world. I mean, I never thought that it wasn't something that was not available. I have a 6-year-old daughter. I don't know what she will have going forward in her life. And I think that for me, my dad practiced medicine in a bunch of different rural clinics in Minnesota, and he would tell me stories. My father was very conservative. He was he was a Republican, everything else. But he would tell me stories of working in these small, primarily Catholic towns, and these women would come to him and basically beg him for an abortion. And he was a family practice doctor, and he said, I can't give you one. And they would have had their 7th child, and they were desperate. So he was the one who shared his perspective with me when I was growing up. And he said, you should be so aware of what this is in your world as a woman. And I want that for my daughter.
I have a very similar answer, which is that my mother always talked about, you girls need to get out there and fight to keep your rights for an abortion, because her sister had an illegal abortion, my aunt, and nearly died. Their father was a doctor, and my mother was furious when she found out that he wouldn't help her sister. And my mother had one of the first legal abortions, having had 2 children, and had an IUD and got pregnant in New York when it was legal. So I grew up talking about it a lot, and I have a 22-year-old daughter and 2 sons, and so I'm hopeful. So the fear is the same, but my hope really is in these 18-year-olds in the audience and you 20-year-olds in the audience, because you guys who are here are way ahead of the curve, and you're going to make the difference. And we were talking about it today. If you get out and vote, 40% of the millennials will make up 40% of potential voters in the 2020 elections. So you guys are it. You're my hope.
You stole my hope answer.
Too much time.
That is definitely my hope answer as well. My continued concern, the thing that concerns me the most, there's a lot of energy and effort being waged in this particular point on women's reproductive freedoms and the continuum. And it's an important one for us to spend our energy on. But it's moving our eye and our passion and our effort away from a place that actually would decrease the need for abortion in the first place. Think about it this way. If we really had as our objective decreasing abortion, we would support subsidized childcare. I haven't heard a Republican arguing for that. We would support an increase in the minimum wage, because the disproportionate minimum wage workers in this country are women, many of them single women, who are raising children on $15,000 a year. Try to do that. We would support pay equity. We would support Medicaid expansion in every state in this country. Texas has the highest number of uninsured people and the highest percentage of uninsured people in the entire country, and not a single Republican in my state is arguing to give access to women to health care so that they can prevent unplanned pregnancy. We would make sure that women's health care clinics who are providing contraceptive care are funded to the maximum that they need so that women who are trying to prevent unplanned pregnancy have the opportunity to do so. We would model every state in this country after Colorado, and we would provide subsidized, long-acting reversible contraceptive care to every single woman who wants it. That's what we would do to decrease abortion in this country if that's what the real goal was. But the real goal is political expediency and political personal gain, and that's why our conversation is stuck where it is. So let's say to our lawmakers, this is what we expect, and this is what we will be voting with our minds and our hearts centered around. And it will be an agenda that says, we're going to do everything we can to support women to be fully equitized and to receive their full opportunity and potential in this country. And with that, we're going to make sure they're educated, that if they choose to have children, their children will have child care, and that if they choose not to, we'll give them the medical care to make sure they can make that decision. Plain and simple.
I won't drop your mic. I mean, how do you follow that? Anyways, yeah. I can be your Surgeon General. Nobody post this on Facebook today, okay? We're not doing this. The last thing I would add is remember to sort of center all of your justice issues in an intersectional way. I think, I think we have real power in our numbers, right? And I think much to what Wendy was saying, abortion doesn't exist in a vacuum, right? It exists because you have to pay your rent, and there's lead in the paint in the housing project you live in, and there's police violence in your community, and you have a child who needs 24-hour sick care from a lung disease, and, right? And so as we sort of fight for environmental justice, and we fight for immigrant justice, and we fight for racial justice and pay equity, remember that all of those things are interconnected, and bring reproductive justice to every one of those conversations, because that's how we sort of gain our power, and that's how we help people to understand exactly what Wendy was just saying, right? That it's not just about the abortion you're having today. It's all of those other things.
I think I can speak for everyone. Thank you. Thank you for the movie. Thank you for coming. It's been a treat.